So it's now recording.
Great. Welcome, everybody. This is Doug McCall. Pleased to welcome everyone to the May session, one of the several fresh school health and nutrition webinars. I am pleased to facilitate this session, kind of pinch hitting for Save the Children, whose staff has been very busy with the COVID crisis. And so I'm pleased to be facilitating and we'll be reading out the questions that you type into the chat box, and we'll be introducing and thanking our speakers. So maybe a brief introduction about these sessions. FRESH is an interagency partnership that promotes educational success, health and development through school-based and school-linked programs. Save the Children and a couple of other FRESH partners have been organizing this series of webinars on low-resource countries for a few years now, and it really is an excellent resource if you get a chance to either go to the Save the Children Resource Center or to the FRESH website. It's a really remarkable set of recordings and readings and resources that are available there. As a community of researchers, practitioners, and policymakers in education and health, we host webinars every month on topics related to children's health and well-being. This month, we are commemorating or celebrating Menstrual Hygiene Day, which is on May 28th. I'm going to introduce our two speakers very briefly and ask them to introduce themselves when they come online. Our speakers are Jacqueline Haver, who is a senior specialist with Save the Children, and Jeannie Long, who's a director with Save the Children. Before we start, just a gentle reminder to those online that we'd like to keep ourselves muted throughout the presentation so that we don't have any ambient noise. So if you could do that now, if you have your mic open, please shut it off, and we'll then turn them back on when we get to the discussion period. If you have questions during the talk, please type them into the chat box, and then I'll have a chance to read them out in the order that they've been typed in. After both presenters have finished their remarks, we'll have a question and answer period pulling from the chat as well as from the general audience. So I appreciate your cooperation in doing that. So Jackie or Jeannie, please jump in and introduce yourselves and also the approach that we're taking to this topic.
Sure. I'll just jump in since I'll get the presentation started. My name is Jeannie Long, and I'm here with Jackie Haver. We've both been with Save the Children School Health and Nutrition team for almost 7 years now, and we support a variety of thematic areas across school health, but we have a special place in our hearts for MHM, or menstrual health, and so we're going to talk a little bit about a process we've gone through over the past couple of years of developing menstrual health outcomes for girls in school. And we're also going to share, then Jackie is going to share some monitoring tools that we've been putting together that come from a variety of country programs that we're going to release and open up so that people can download them and use them in their own programs. So I will get us started. Moving the slides. So this is just the agenda, which I briefly went over. We're going to talk about menstrual health and hygiene programming within school health. We're also going to talk about research, some research on menstrual health and hygiene, in particular related to girls' education. And then we'll talk about the menstruation-related engagement, self-efficacy, and stress assessment. We'll talk about its evolution, how it was developed, how well it measures what we want it to measure, and then we'll talk a little bit about next steps. And then I'll hand over to Jackie for the monitoring tools. In the past 7 years, menstrual health has become integrated across 20+ projects in our portfolio. When we started 7 years ago, there were only 3 countries that had any menstrual health programming. And since then, Save the Children has not only increased the menstrual health programming taking place across the movement of Save the Children countries, but it's also been an active partner with coalitions of other NGOs, researchers, and multilateral organizations to advocate for more visibility of menstrual health in development. And that includes participating in menstrual health strategy, coming up with the new menstrual health and hygiene global definition, which I'll share with you briefly, being part of the group that suggested menstrual health questions for the demographic health survey, as well as supporting the development of the WHO's menstrual health strategy. So we have been an active player in this space. Menstrual health is typically not a standalone theme for school health and nutrition. Usually it's an element or a strategy within a larger school health program. And typically it's combined with WASH or sexual reproductive health programming. However, like any other health theme, we really require 4 pillars of programmatic elements to do it well, and those are aligned with the FRESH framework. In other words, pads or hygiene products are not a silver bullet for menstrual health and hygiene. And like anything else, we have to consider the school environment, school services, skills-based education, and the policies that will enable proper menstrual health and hygiene. Many people on this webinar have probably been using or use menstrual hygiene management, or MHM, and that term still is relevant and it is used, but the focus has been more in MHM, the focus is more on WASH, so water, sanitation, and hygiene. And actually the WASH sector really is where menstrual health got its boost and attention from the international community. So, but among menstrual health practitioners and researchers in the MHM sector, or the MH sector, many people have started talking about it more broadly as menstrual health and hygiene, because we understand that menstrual health encompasses more than WASH, and that is a direction that we have been moving our programming as well. We recognize that menstrual health and hygiene is truly an integrated topic. It's a cross-cutting topic, and it requires us to consider the physical environment of girls. Often is about toilets and water, as well as the sociocultural factors, social norms, stigma, and harmful traditions that influence girls' ability to manage their periods with dignity. And so what I have on this slide, which I'm not going to read all of it, is the draft of menstrual health and hygiene definition, which if you look at this definition, you see that it is trying to encompass the physical, emotional, and mental and social well-being related to menstrual health. It's about considering menstrual health across the life cycle, recognizing that menstrual health and menstrual cycles changes during the life course of a woman, and that there are other conditions related to menstrual health that really haven't been acknowledged in the past. And so this is a more comprehensive definition of menstrual health that we hope is more inclusive of different populations. For us today, we'll be talking about menstrual health, particularly for girls in school, and how it may be a barrier to education. Health is defined as having physical, mental, and social elements, and just like health, menstrual health also has similar challenges that girls face across these 3 facets of health, ranging from menstrual pain to self-isolation, to potential UTIs, and as well potentially not going to school as one barrier to education. And because of that, that's been a big interest for many researchers, is to kind of understand better what the link is between poor menstrual health and girls' education. If you learn nothing else from this presentation, I hope you remember that if you ever see the statistic in a proposal or in a report, that you should take it out. This is probably one of the most popular citations that people have seen regarding MHM. 1 in 10 girls in sub-Saharan Africa misses school during their period, and it's often used to justify MHM programming. But it came from a UNICEF study maybe a decade ago that was a small qualitative study, and it's morphed into this big citation over the past decade. But it's probably because of this that there's this big interest in MHM and education. So don't ever use this. However, there is a ton of other menstrual health research and education or related to education that we can talk about. So what is menstrual health and education? What does the research say? The challenges that girls face along with some of their reports have encouraged, basically the challenges that girls face can encourage them to miss full or partial days of school, and that has been of increased interest, especially for ministries of education and others who are interested in girls' education. However, the evidence of menstrual health's impact on education is varied and mixed. And that's because of methodological differences in measurement and study design, as well as contextual differences between countries, cultures, intensity of stigma, and other factors that we know often impact attendance. So it's not as easy to measure as you would think. The evidence listed here shows you that there's a variety of findings across menstrual health studies that are related to attendance. In Bangladesh, they found that girls were more likely to miss school during menstruation if they felt uncomfortable being at school during their period, if they believed that their menstrual problems impacted their school performance, if they attended schools that had locked toilets, or faced cultural restrictions during menstruation. In Malawi, a cross-sectional study of rural girls found that 1/3 of girls that were interviewed reported missing at least one day of school during their last menstrual period. And in Uganda, you see kind of the variety of how menstruation can impact, or how absenteeism and school participation is different, even in 2 studies in the same country, where they found that among high school girls and boys that they missed class equally, but that if you looked into the reasons why they missed class, that girls were more likely to miss school on the days they had their periods, versus boys were more likely to miss school to work. And in another study in Uganda, that girls who attended school during their period, the majority of them were more likely to avoid standing in class to answer questions while they were there. So there have also been a handful of studies and more that are coming out evaluating the impact of menstrual materials on education and education provision on school attendance, but those have also yielded mixed results. Some interventions showing that they improve attendance of girls, and some interventions not making a difference. However, when we talk to girls about their daily lives and their difficulties managing their periods in school, it is clear that there are many contexts where girls face challenges. We have close to 20 years of qualitative research that involves talking directly to girls, and recognize that while the empirical data is still lacking, or there's a need for more consistent results, that in many countries the first period and the early years of menstruation can be difficult and sometimes traumatic. The challenges that girls face, whether they're cultural stigma, a lack of wash facilities and hygiene products, social support, or basic information, can lead to shame, social exclusion, confusion, fear, and reduced participation in school. So for this reason, we started to think about how we could measure outcomes that might be somewhere along the causal pathway between poor MHM and absenteeism. These domains that you see in yellow, increased participation, reduced stress, and self-efficacy, are topics that are commonly cited in qualitative research, which is why we selected them when we started to research them. We thought we might not be able to attribute reductions in absenteeism to menstrual health programming, but we could potentially show through a program that we are improving girls' participation in school lowering their menstruation-related stress, and increasing self-efficacy, thereby potentially changing behaviors that would lead to absences. So that's how we got to the menstruation-related engagement, self-efficacy, and stress assessment. And what I'm going to talk about now is the process of developing these measures, as well as assessing how well our tool captures these domains of interest. So what you see here is a timeline of the development of Menses, and much of the beginning of this process started in 2016, where we decided that among these three domains of interest, we wanted to do some qualitative research, formative research, to understand how girls actually talk about these areas: participation, stress, and self-efficacy, when they had their period at school. And then we used that data, that qualitative data, to create a quantitative survey, and often using some of their words and the way that they talked about stress, for example. We piloted that assessment in El Salvador for the first time at the end of 2016, and since then we have tested it in several different countries, as you can see, at least 1 or 2 a year. And in between each assessment, we've made edits to the items, to the response options, to the length of the survey, to the wording of the survey, to improve it with each use. Much of the work has been supported through child sponsorship funding, and that has allowed country programs to not only conduct these assessments, but to develop programming tools, curricula, training, etc., for their programs. And, it's no use to us or to country programs to conduct assessments if there isn't going to be quality programming in between. So as you can see, the process has been slow, but it's because Save the Children has been piloting this on our own initiative, and we're not a research institution, so there always has to be a lot of programming in between and partnerships in order to make this work. But we are looking to expand, and I'll talk about that a little bit later. Because Menses has been applied in multiple countries and in multiple programs, we have nested it within other surveys. So this slide gives you an overview and kind of an example of how of kind of the population that we would start with sampling, and eventually who would take the Menses assessment. We also show some of the other topics that might be included in a survey along with Menses. What's important to mention here is that we do include basic demographic questions. So in the Philippines, we looked at who lives with the girl and her family. And in both Mexico and the Philippines, we used proxies for socioeconomic status. And usually we include other knowledge and attitudes questions on topics that both girls and boys can answer, regardless of their menstrual status. In the Philippines, we added a reading comprehension section, and that was kind of to, again, attempt to further test our hypothesis, looking at the link between menstrual health and education, because as we believe that girls' participation and stress may be affected by their menstrual health or their ability to manage their period in school, we think that their ability to perform in school may also be affected. This is just 3 sample questions from each section of the survey, so you can see how it's worded. Each section starts off with a sentence that's repeated in every question. So for participation, the last time you had your period at school, when the teacher asked you to go to the board for an activity, you asked to be excused from it. Always, sometimes, or never. And there are different response items in each section, but in the Mexico example, we did use color-coded cards to help girls better identify or select their response item. All of the teams that applied this tool had about a week of training. including pilots. How the Menses assessment is analyzed is that the Menses assessment is comprised of three sections. Each section pertains to our one construct of interest, so stress, participation, and self-efficacy. In order to analyze it, each section is looked at separately to see how questions interact with each other and to test if they measure stress, self-efficacy, or participation. Within each domain, items that hang together or form the construct, and this is based on statistical tests, are used to assess change between baseline and end line. So we started with 44 questions, and after assessing which questions really hang together or statistically measure our construct, we ended up with 33, and we'll go into a little bit more of those results. In the Philippines, we were able to conduct a baseline and an end line. And you can see we sampled about 645 girls in the 5th and 6th grade. In Mexico, we sampled 331 girls in 5th, 6th, and 1st of secondary, and we have baseline data for that. We hope to collect an end line, but with COVID-19, we're not sure when that will happen. This is a summary of the analysis, and we have the different statistics to show this, but we're not going to show it unless we are particularly asked. But I wanted to kind of make sure that we're transparent about the process we went through. What I'm talking about right now is basically validating the Menses assessment. We wanted to see how well the observed variables represent participation, stress, and self-efficacy constructs that we are trying to measure. So that was first initiated by conducting an exploratory factor analysis with just the Philippines baseline sample. We observed several fit statistics and basically chose a subset of those 44 questions that we felt provided the best goodness of fit or the best model for the baseline data. And then we took that model of those 33 questions and we applied that model to the end line data for the Philippines to see, using confirmatory factor analysis, does this new subsample of items in each domain still accurately measure our constructs of interest. And we do have some statistics that show that the model fits very well. We looked at internal reliability, and we also looked at inter-rater reliability, which is inter-rater reliability is collected by having 2 enumerators assess one survey respondent and then comparing how similar the results are across enumerators to ensure that they're applying the tool systematically the same across each girl. And with those results looking good, we then took the Philippines model and validated it with the Mexico data. So we took a totally different subset from a different country of girls, and we saw that the model that came out of the Philippines was applicable to the Mexico data. So then when we felt comfortable with the model, we compared baseline and end line data of the Philippines with that new model, and we created composite scores for each domain to assess change between baseline and end line. The 3 domains each range from 0 to 3. We want participation to increase, we want self-efficacy to increase, and we want stress to decrease or go down. What we see here is that between baseline and end line, participation remained the same after the intervention. However, we did see within the items that fewer girls missed a day of school between baseline and end line, and more girls reported having a difficult time concentrating in class, and more girls did not feel like doing their homework on the days that they had their period. We saw a slight decrease in menstruation-related stress, but it wasn't statistically significant. Girls reported decreased feelings of loneliness on the days they had their period, but they had increased anxiety of being peeked on in the bathroom, and they also had increased anxiety of worrying of having enough water in the bathroom on the days they had their period. we did see that self-efficacy increased, and it was highly statistically significant. Girls were more confident to access sanitary pads at school. They had increased confidence they could use the bathroom at any time they needed, and they felt more confident in their ability to ask a teacher for help if they stained themselves. Additionally, after a multivariate analysis, in the Philippines data, we found that having a female teacher was significantly related or associated with lower stress, higher participation, and self-efficacy. And at Nline, girls that lived with both their mother and older sister presented a higher score on self-efficacy. Girls who lived with either a mother or a sister exhibited lower stress compared to girls without this female family support. Additionally, and kind of very exciting to see, was that girls from grades 5 and 6 who had higher reported self-efficacy, menstruation-related self-efficacy, also had answered more reading comprehension questions correctly. In both countries, we found that girls with higher socioeconomic status also had better Menses outcomes overall. In conclusion, there is evidence to support the content validity of the Menses assessment. Scores within each domain are internally consistent, and data collectors can apply the tool consistently when trained. Our next steps are to collect Menses data in Nepal and compare that with the Philippines and Mexico data, especially the reading comprehension findings. We want to collect Nline data in Mexico and compare those trends with the Philippines. We also hope in the next assessments that we can add the demographics of teacher sex, socioeconomic items, status items, and reading comprehensions into future Menses assessments. We also, from a measurement perspective, want to understand what a meaningful change over time is. So the change in the Philippines of 0.2 was very significant, and the sample wasn't so huge that anything could be significant, but we do want to know kind of what does that mean? And finally, more importantly, we want to investigate why the Philippines program didn't have an impact on the school participation or stress scores. And that requires an in-depth review of the tool and comparing it to the intervention, because what we don't know is, were there elements of the intervention that our tool did not measure? Were there kind of intervention strategies that we could have done that would have improved the score? And also, are there, for example, on the previous slide, we talked about girls being worried about not having water at school. Some of those environmental components really aren't under the control of the program. And so how many of those things are we measuring that we can't actually control? And finally, moving forward, we do want to continue to see how the measurement tool works. Are there improvements that could be made? And we do get a lot of requests to share the tool. We would like to expand those who can use it, but we would share it under the kind of the following circumstances. Anywhere where there's a comprehensive menstrual health and hygiene program that's committed to collecting baseline and Nline data, that's working with girls 10 to 14. And of course, it doesn't have to be just the Menses assessment. It can be embedded with other assessments. We would want any program team that uses it to take an in-depth technical training so they know how to use the tool. And we would want to see the final changes, adaptations made to Menses before it's applied. And finally, we would like to access all the raw data so that we can continue to compare and analyze with the other countries we're conducting this assessment in. And really briefly, I just kind of want to give credit to all of those colleagues that have worked on this with us. It's been a long journey and a lot of effort from many, many different stakeholders. And so just want to make sure that their names are on the screen and on the recording, since without them, we couldn't have done this. If you have questions, feel free to reach out to us. And I will hand over to Jackie for the monitoring. Jackie, if you want to just tell me when to say next slide.
Great. Thanks, Jeannie.
Thank you, Jeannie. And just before Jackie begins, just to remind folks that we're going to have a question and answer period at the end of the session. So before you forget your questions, please type in your question into the chat box, and then we'll come back to them after Jackie's presentation. Jackie, please.
Great. Thanks, Doug. Thanks, Jeannie. So my name's Jackie Haver, and as Jeannie mentioned earlier, I am a technical advisor with the School Health and Nutrition team, and we've been working together for a long time on the menstrual health and hygiene work, and co-leading this global portfolio together. And but more closely, I've been working more closely with programs in Kyrgyzstan, Philippines, and Nepal to advance our menstrual health and hygiene work. And I'm going to be sharing with you our program monitoring guidance and tools. Next slide, please, Jeannie. So in many, just as kind of background or rationale for the latter, in many of the contexts where we work, there is a significant gap between the ideal school and the current situation. So for example, these are two school toilets from schools in the Philippines. And on the left, you're seeing a dirty toilet lacking the basic items that a user would need to actually manage menstruation with dignity. And on the right, you're seeing a toilet that has a covered waste bin, a door that locks, soap for hand washing, water for personal washing or flushing. And these are toilets at different schools, but within the same program or within the same area. And this is just one example from the Philippines. We see similar challenges across schools globally and across countries where we're working globally. So we found that our program staff needed a step-by-step approach to gradually assess progress towards meeting expected outcomes. So in addition, we're finding that school and project staff really need to know which sub-outcomes are met and which are partially met or which are just not met at all. And this is so that they can actually target their use of resources to ensure that children are healthy and safe. Next slide, please. So before I actually get into the details of what the ladders and monitoring tools cover, I do think it's important to share a little background on what went into informing this resource. So the menstrual health and hygiene thematic ladder is one in a set of 3 ladders that the school health and nutrition team have developed, and the other 2 ladders are for WASH and nutrition. And the thematic ladders draw on our collaborative work for SDG 4 on education, but specifically the UNICEF WHO Joint Monitoring Program for WASH in schools and the core questions and indicators for monitoring WASH in schools in the SDGs. So, and then additionally, the organization of the ladders and the guidance within each service level, these align with the FRESH frameworks for core pillars for comprehensive school health and nutrition, and then also, which also align with Save the Children's, a common approach for sponsorship programming on SHN. And then the actual package of the monitoring tools, so the individual tools that we've packaged, this is a collection of tools that we've developed for use in Save the Children programs in Mexico, Philippines, and Kyrgyzstan. And but it also draws on tools that have been adapted from the Emory University and UNICEF WASH in Schools Empowers Girls Education tool for assessing menstrual hygiene management, and then as well as the WHO practical tool for surveillance on WASH in schools. We recognize that there's no need to recreate the wheel when there's something that works, and as such, we've tried to really package tools that we've used or adapted over the years for monitoring MHM programming, and then with accompanying instructions so that it's easier to apply. Next slide, please. Yeah, thanks. So the ladder contains milestones for any school or schools in a sub-district or an entire project. And this is to meet the basic requirement for the sub-outcomes under each expected outcome. And the levels in the milestones are based on the levels of service that children receive and include 4 levels for each sub-outcome. So no service and limited service, that's fairly self-explanatory. And then basic services would be meaning that the school meets the basic requirements for the expected services. And then advanced services is when the school goes beyond those basic requirements, for example, linking with community so that children are able to access services. And I'll provide examples in a moment when I open the tool. So I'm going to pause here and I'm going to try and share my screen so that you can see the tools. Share. Can someone just tell me, yes, I can see this?
We can see it.
Okay, great, thank you. So here's the Excel book, and it has a number of tabs that provide fairly straightforward guidance for using the ladders and tools. And first, we have the instruction tab, which provides an overview, key application steps for actually contextualizing the ladder, and tools across the context, and as well as analysis instructions. And then we go over to tool overview, and this is really a map. This tab maps out the various tools included in the Excel book, and it helps to identify, it links each tool really with the applicable sub-outcome, and the information that each tool collects and guidance for using the tools. And I think it's important to note that these tools are templates, and program teams are expected to modify the tools according to the specific programmatic M&E needs. These M&E tools allow for measurement of programmatic outputs and outcomes, but they do not measure impact. And so then let's go over to the matrix itself. So the MHM ladder matrix, okay. It's a little bit, I think it's a little small, but this I'll try and walk you through some of it. But so the menstrual health and hygiene ladder can be used at any stage of the program cycle, but it is easiest to utilize if the actual sub-outcomes and service levels are integrated into the programs from the beginning. So at each stage of the program cycle, the tools should be adjusted to collect the necessary information to actually respond to the milestones. So looking at column A, do I need to make this a little bigger? Looking at column A, as noted, these sub-outcomes are organized by the fresh pillars. So sub-outcome 1 aligns with access to health services. Sub-outcome 2 is linking with the quality learning environment. Sub-outcome 3 aligns with skills-based health education, and then sub-outcome 4 aligns with community support and advocacy. But let's take a closer look at sub-outcome 1, starting with emergency sanitary supplies. So again, no services in column C, it's pretty self-explanatory. And then we've identified what limited services might be. For emergency sanitary supplies, it's that there are supplies available in the school, but they might not regularly be maintained. And that that the sanitary supplies are actually contextually appropriate. We feel that's very important, even at the limited level. For the basic services, it would be that those supplies are accessible in the school throughout the day, that they are contextually appropriate, girls are able to access the supplies as needed, and that the school maintains a record of the supplies that are distributed. And there is some sort of system, either through the government or the school, to replenish those supplies. And then at the advanced level, it's everything that's included in the basic services. And then in addition, additionally, there is a system that actually helps to monitor and finance based on the national policy. That there is actually a policy that includes a provision for actually financing those supplies. And then what I think is useful in this, not only going back to the tool overview, but column G identifies which monitoring tool you would then use to help identify or help monitor this. And then column H, we've kind of thought through like what gaps might exist. It's not perfect yet. We don't have all the answers, but for example, if you're thinking about how do we monitor the context, like whether or not the supplies are contextually appropriate, there is no specific measurement tool in place for this. But what we would want is that the programs ensure that the knowledge, attitudes, and practice survey for schoolgirls does include questions on perceptions of supplies, so that we're able to assess the appropriateness or the acceptability. And then moving over to column I, we have included operational definitions, recognizing that there may still be some questions. So like, what does emergency sanitary supplies include? This would mean that that these supplies, excuse me, sorry, these supplies really should include disposable or reusable sanitary pads. And then depending on the context, there might also be extra underwear or clothing or uniforms for changing, and that the supplies should be available to students in case they don't have the required supplies with them at school. So really for an emergency. And then what does regularly available mean? That's, we're defining it as available all the time or always, or all days that the school is actually monitored. So in the interest of time, I'm not going to go through all the sub-outcomes, but know that these resources will be available for download on the resource, Save the Children's Resource Net, and it will be open access. So next, I'm going to quickly highlight some of the accompanying tools. So we have the school profile, and this is pretty. It collects school profile information, and then the school facility observation tool. This tool covers elements including availability, functionality, privacy, accessibility, quality, operation and maintenance, as well as WASH education, policies and practices in the school. And this is an example of where we've adapted directly from UNICEF, the UNICEF WASH in Schools monitoring package with additions from the WHO observation instrument. And at points we've kind of then contextualized based on the needs of this, linking to the service ladder. And then here you're seeing, sorry, let me just scroll. So this is the MHM facilities tool for teachers. And again, this is adapted from UNICEF, Emory, and WHO tools. And this collects information on student population, water access, toilets, latrines, disposal, operation and maintenance, financing of WASH facilities, hygiene, and MHH education and teacher training. So then we have the menstrual health and hygiene monitoring checklist. And let me just, so you can see this, this one's fairly extensive. And it collects data on, it collects information on the availability or distribution of emergency sanitary supplies, pain materials, current status of WASH facilities, menstrual health and hygiene IEC and promotional materials, and the availability of operational and policy guidance, and different monitoring of activities at school. So this sheet was adapted from Save the Children's Child Sponsorship School Health and Nutrition Program in the Philippines, as well as the Girls' Wellbeing Menstrual Health and Gender Equality Program in Kyrgyzstan. So we have used this one across a number of contexts. Hold on. And then we move into sorry, let me open this up. We have one section of the tools that we weren't able to build all into one Excel. So, oh, this is 5.1 and not 5. Sorry. Bear with me.
It's always hardest to find it when you're
Yeah.
rushed, but I'll take the opportunity to note that Mohini has posted the URL for the resource in the Save the Children Resource Center in the chat box.
Great, thanks, Mo. Okay, I think this is the right one. So the monitoring checklist, the training, so these are training, monitoring, observation forms. And so this basically summarizes all the different training activities that are conducted during the project or program. And it looks at everything from student sessions to clubs to training of teachers. And it collects data on all of these different sessions. And then we also have, oh, I'm trying to find it. We also have teacher session reports, and these reports are from teachers on the lessons that they've actually delivered in schools, providing data on their adherence to the curriculum in the classroom. And then additionally, there is a, hold on, I'm trying to, sorry. No, yes, here we go. Here we go. Oh, no.
Hi, everybody. While Jackie is looking for this, I just want to let people know we will have about 10 minutes for Q&A, and it's actually 9:46, not 9:41. Jackie's clock is wrong, so I just want to let people know there's about 10 minutes left for
okay.
session.
Yeah, and so sorry, I'll just wrap up on these. So these reports, the educational session guides were developed from the Save the Children We See Equal project in Mexico, and they do help to identify what educational material is being delivered, how it's being delivered, and then there's also the opportunity for observations of the sessions as well. And so there are also, without getting lost in all these Excel sheets at the moment, there are analysis instructions for the school level, but then also to look at the information collected from schools and trying to being able to actually, it helps you to be able to prioritize sub-outcomes that are identified through using the ladder. So ideally, when we come back to, sorry, so ideally what you're able to do is identify which schools or which areas within the school, which levels are at the no service or at the limited service, and help them identify activities or next steps to actually move throughout the ladder, so that ideally you're getting to a place where you have those basic services or maybe even reach the advanced level. And so I think that one thing to note is that the ladder and the corresponding tools, these are really intended to help us to be able to monitor and program to ensure that there is implementation fidelity. So as we develop the Menses assessment that Jeannie shared earlier, that's to measure impact. We need to understand what and how those interventions are actually being implemented within the schools and communities. So I'm going to pause there, and I think that let's have a few moments and save some time for answering any questions.
Great, thank you. Thank you, Jackie, and thank you, Jeannie, for the excellent presentation. I'm going to just pick out a couple of questions that were more clarifying, seeking clarity, and then maybe close off with a little broader discussion. So Penny had noted earlier in the presentation, she was asking a question about the duration between and before the pre and post test time, and also made a bit of a comment about the comparing these, controlling these as the children get older. Can Jeannie or Jackie comment on that question? It appeared in the chat box.
Yeah, and I'll say a little bit, and then Jackie maybe can give the details of the duration between. We actually, one of our main questions is about, especially with self-efficacy, whether that's something that might improve with age. What I will add is that we do survey the same girls, so the baseline and end line does represent girls, the same girls. So we do, it's longitudinal in that sense, but we haven't been able to do a comparison. And I just to say that what I didn't show, in order for us to get a sample size that's big enough, what we found is that when you're surveying girls from fifth, 6th, and first of secondary, or what would be 7th grade, typically only 12% of those girls have had their period at school. And so our sample size has been really, really tiny, and it involves sampling a lot of schools. And so what we're trying to grapple with is we want to do either have a control group or a comparison group, but recognize that the cost and the time involved in doing that at this stage of the tool development wasn't quite worth it yet until we felt like we had a solid enough instrument. Jackie, do you have anything to add? I don't know if you know the exact time frame between. Yeah, I know so it was about a year.
Yeah, it was a little over a year. So for the Philippines, we collected in, I think, between August and September, and then we that was for the baseline. I think that was 2018, and then 2019. Sorry, years are blending. But I know that we did the end line in again October. So it was about 13 months different for the intervention. And the main reason for that was we had intended to do it a little bit sooner, but there were floods, there was rain, there were a few delays. But also we wanted to ensure that there was a full school year of intervention before we did the end line. And so in the Philippines, we were able to follow up with, so it was girls in grades 5 and 6 in the first year, and then the following year it was girls grades 5 and 6 again, and there was one cohort of similar girls. So the girls that are in grade 5 the first year became grade 6 girls in the second year.
Great, thank you for that. There was a couple of comments and questions around the notion of how you measure socioeconomic status. So I wonder if Jeannie or Jackie wanted to comment on that. The question was really around how is it measured and how can it be reliably measured?
Yeah, so we for Mexico, we worked in the impact area in Valladolid, Yucatan area, and we had done other assessments on literacy and kind of in that same area. And so we did use the proxies for SES that we had used in those that we thought were contextually appropriate. In Yucatan, we only used 2 items, so probably not enough. But that's how. And then in Mexico City, Puebla, where we did some other work in Mexico, we based it off of USAID's indicators. Jackie, I don't know how the Philippines
So
worked.
in the Philippines, we used whether or not there was a toilet located in the home, access to cell phones and computers, and I think that I'm trying to remember the third one. There was one more question, and it's escaping me right now, but I need to go back and look at the tool. but we felt that they were working with our program team. It was appropriate to the Metro Manila area that we were working in.
Great, thanks. One more question and comment, and then we'll move to close. Jonathan commented on the WIN monitoring tool in the Philippines using a 3-star approach, and I really like the rubric that's available in the tool. It avoids the question of yes/no checklists, and really appreciated that. Can you comment on that? How it's been used and how participants using the tool or the survey have been able to use that kind of more qualitative yet still factual approach.
So thanks, Jonathan. And also, I do think that it's important to mention that the development of these ladders was kind of inspired by a conversation that we had with Jonathan a number of years ago at UNC. And it was when we were starting to think about how we might develop something similar. We were also looking to learning from the Philippines' approach to their 3-star monitoring. And so I think Jonathan knows this tool quite well. But in terms of the ladders and an application, we should note that we have not used the ladder per se in a country office. We do need to still test it out. The monitoring tools we've used across a number of countries, but we haven't applied the ladder yet.
And we are testing actually in Mexico. We are adapting the tool right now and seeing how it can be used. What they would like to do is use it as a way to prioritize resources. So kind of seeing where are schools in the red and where should they work to improve, whatever service, whichever what needs to get to the basic service. And so we will, theoretically, those ladders, they make a lot of sense. How it's implemented is going to vary from country to country. And I think the Philippines 3-star approach, they've gotten into the nitty-gritty of how to monitor schools, and they have everything kind of linked. But it's a lot harder to do that across different countries. And so we have to acknowledge that there's going to be some flexibility and some adaptation involved. And that's why we haven't tried to link everything. We want to see how countries want to do it and how it's useful for them.
Yeah, we wanted to leave it, recognizing that we do work across continents. We've wanted to leave it generic enough that it can be adapted.
I'll jump in with that opportunity to point out, Mohini has asked whether the tool could be digitized and offered to girls as a kind of a self-assessment tool, but also the digitization process in terms of making it adaptable across countries is also something that maybe another step in the development of the tool. So I wanted to close up with a real big thanks to our 2 presenters and to Save the Children for this presentation. With just a brief comment, there was a discussion in the very beginning about using statistics and turning them into slogans. And as one who's been trying to track down where the 1 hour of physical activity came from and trying to find the science behind it, it's the danger of doing that is maybe a lesson we can all learn. And I really appreciated the clarity and the rigor of the presentations today, and of the tool and of the survey. They are really very, very good and very, very clear. And so I'm really appreciating the presentations that were made today. I am under strict instructions to finish up before the hour, so we have just 1 minute left, and wanted to remind everybody for the next session in this series is on June 16th. That's a Tuesday, and we're going to be looking at tobacco reduction. It's celebrating the World Tobacco Day, and that theme of the World Tobacco Day is on the tactics used by tobacco companies to market their products to kids. And so we're looking for a school-based program that matches that kind of advertising or media campaign. So we'll be hoping to highlight that theme and that kind of presentation on the 16th of June. Jean or Jackie, any further comments, or Sung, if you wanted to add any final comment, it would be great.
I would just say that if anyone's interested in learning more about these tools, don't hesitate to reach out to us, either Jeannie or myself or Sung, and that when we share the recording, there will be a link to being able to access these tools.
Nothing from me. Thank you both, and thank you, Doug, for stepping in for us.
No problem. It was fun. Great session.
Thanks, Doug.
Take care, everybody.
Bye, everyone.
Yeah. I think everybody needs to leave the room. I'm not sure about Zoom. I sometimes have had trouble with other platforms.
We will end it, and I am stopping the recording as of now.
Perfect. Great. Thanks, everyone. Everybody have a good day or a good evening.